Ifeoma Monye, a seasoned strategist, project execution and operations management specialist. Please permit me to read a bit of her profile as she comes up to moderate this session. Ifeoma Monye is a seasoned strategist, project execution and operations management specialist with over 20 years experience. She is an expert at guiding organizations and individuals in articulating their visions, building efficient processes and systems to drive optimal performance by providing them with the necessary tools to build sustainable institutions and legacies. I know she cannot wait to take on her role as moderator, so I'll let her do her job and introduce the rest of the panel. I hope you find this conversation insightful and that beyond that, it will get us all to think and furthermore, take action. Thank you.
Thank you. Good evening, ladies and gentlemen. It is my pleasure to moderate this session. This is a sector that I'm very passionate about, and I'm happy to be able to moderate with some of the key players in the sector. Our first panelist is Dr. Alero Roberts. I read a bit of her profile. Dr. Alero Roberts is a consultant in public health and senior lecturer in maternal and child health at the College of Medicine, University of Lagos. She has worked effortlessly at enhancing rural primary care service delivery and in the development of strategies to improve universal access to quality care for mothers and children under 5 years of age. She has appeared on Nigeria's weekly COVID-19 special updates on Channels Television and uses social media to put pressure on wealthy members of the society to step up and help fund adequate personal protective equipment for healthcare workers. Please welcome Dr. Alero Roberts. We also have Dr. Pamela Ajayi. Dr. Pamela Ajayi obtained her medical degree at Louth and postgraduate training at the British Council of Chevening Scholars at St. Thomas Hospital and King's College Hospital, London. With a vision to provide fast, accurate, and international standard diagnostic tests, Dr. Ajayi started Pathcare Nigeria in 2004, the first internationally accredited clinical and medical laboratory in West Africa. A distinguished medical practitioner with a passion for raising the standards of medical practice, she serves as the publicity secretary of the Healthcare Federation of Nigeria and has contributed immensely to the development of the group's objectives. Welcome, Dr. Pamela Ajayi. Also joining us is Dr. Fejiro Chinye-Nwoko. Dr. Fejiro Chinye-Nwoko is the GM of Nigeria Solidarity Support Fund. With a proven track record in designing and implementing multi-donor projects from inception to completion, she's ideally placed to oversee the focus on a vaccination program for Nigerians, driven by her passion for healthcare delivery. Welcome, Dr. Fejiro. And our last panelist, but certainly not the least, is Dr. Tomi Coker. Dr. Tomi Coker is the Honorable Commissioner of Health at Ogun State and has been leading the state's innovative response to COVID-19 disease. Dr. Coker obtained her medical degree from the prestigious University of Ibadan and her housemanship at the University College Hospital, Ibadan. She was appointed as consultant obstetrician and gynecologist at West Hertfordshire Hospital's NHS Trust in 2003, where she rose to the post of clinical director. She has held roles as the vice chairman of the Royal College of Obstetrics and Gynecology Nigerian Liaison Group. Welcome, Honorable Commissioner Dr. Tomi Coker. Our topic was actually, there was a change in our topic. There was a mistake. We're actually talking about the gaps in accountability and transparency in the healthcare system. As you noticed, the two ladies to my left and my right are doctors, but I'm actually not a doctor. And it's part of my own story and why I'm here. And I'm going to take a leaf from where Dr. Coco Kalango, sorry, I'm calling everyone doctor. I've been mentioning too many doctors. Mrs. Coco Kalango read in the nonfiction. I came into healthcare through my own personal story and my experience. And I came into healthcare without realizing I was trying to write my own story, right the wrongs I had experienced. I've given birth in Nigeria, in the UK, and in the US. I have lost multiple pregnancies. I'd already had 2 horrible experiences in the Nigerian hospitals. One, I was told I had what was called a blighted ovum, and the doctor dismissed me. He didn't explain what a blighted ovum was. I had to go Google it. He told me to go meet his receptionist to book for an evacuation. My second horrible experience was when I had done the evacuation. I was lying down at the doctor's office and some bankers came in and they had a discussion over me while I was at the doctor's office. At that point, I decided I was never going to go to a hospital in Nigeria. Then in 2010, I was 24 weeks and 2 days pregnant and I was in the UK. Long story short, I go in, I wasn't feeling fine. The nurse I spoke to said, come into the hospital. I went into preterm labor. Immediately, they found out. My clothes were being ripped, all sorts was being put on me. And a nurse came in and says, look, you're 24 weeks. Your baby has a 40% chance of having brain damage. This is what is going to happen. You're going to go to the NICU. We're trying to stop the pregnancy. I lost my son. He was stillborn. At that point, they asked me if I wanted to see him. I said no. So they did fingerprints, did footprints, took photos of him, gave me the blankets they had wrapped him in, and asked me how I wanted him to be buried. 2 years later, I got pregnant again. I was going to go to the US, but just before I went to the US, I went to the doctors to get my notes to travel. The day I got to the hospital, everything was fine. I got the all clear, got my notes, and went home, ready to leave 2 days later for the US. I woke up in the morning, and I felt funny. I knew something was wrong. Immediately, I knew I was going into labor. I rushed back to the hospital, saw the nurse, and I said to her, I'm going into labor. She said, God forbid, go and sit down. And so I did. After a while, I was in pain again. So I went to her and I said, look, I know I'm in labor. She says, go and sit down. At that point, I sat down, I started crying. I called my husband, I called my mom, I called my mother-in-law. I was in so much pain, I started to scream. Another nurse comes, then now decides, okay, let's do an internal check. She did the check and saw I was going into labor. They took me to a room and started screaming for someone to put on the generator. The nurse left. After a while, I knew I was going into labor. So I started screaming for help. No one came. I delivered my daughter. After 5 minutes of screaming, a nurse comes in, and this is a true story. This is what I experienced. A nurse comes in with no shoes, a bar in her hand. You don't deliver. Your baby don't die. And then walks out. I stayed in that room for a few hours by myself until a doctor came. My husband, my mother-in-law were downstairs. The doctor now puts the baby in a bucket. Till tomorrow, I don't know what happened to that baby. And so that's my story. And then for years, I didn't go into a Nigerian hospital, not even a pharmacy. But then I thought to myself, we can't keep having these stories. We need to make a difference. I'm a management consultant. My husband and I are management consultants. So we were like, how can we help? We're not doctors, but we can help hospitals. So for 2 years, pro bono, we went to hospitals and we told them how to do the system. For example, why have an A&E on the second floor? Why put 2 babies in an incubator? These are the things we saw, and that's how we got into healthcare. And now we currently run a 200-bed hospital for the Edo State government. During COVID, we ran an isolation center. And so that is my story and how I'm writing my story. And so ladies, based on that, this is a really important topic, addressing the gaps in accountability and transparency. I will start with you, Dr. Alero. Yes, there are a lot of gaps, but let's start with, what would you say is the most immediate concern, or how do we start addressing the issues? There are many, but what would you say is one of the main ones that we should start addressing?
Leadership. In a single word, leadership. I think whether you like it or not, fish only gets rotten from the head downwards. And this pretty much, for me, describes a lot of what... I wish I could say that your story is the exception, but it is most and generally the rule. And anybody who knows my story knows that not quite the same, but coming up against the discrimination, the stigma, the lack of empathy, the misunderstandings, the unintended, how to keep quiet sometimes. And when I think of having to communicate with patients, I'm also the Servicom Nodal Officer for the Lagos University Teaching Hospital. So issues of poor service delivery land on this phone. And I'm sure many people have noticed I'm running in and out all the time. 99% of the times, no exaggeration. All it takes is a gentle answer, and everybody calms down, and we're able to explain the situation. Now, if I am to I won't take any of your stories, they're a bit too painful to think about, but I'm thinking of the story that Mrs. Kalango read out. And all that was needed was a gentle answer from the nurse in the outborn wing. Procedurally, the story was accurate, and procedurally, it's pretty much what we would do in the health space. What was wrong was the communication tactic. That was just totally off-putting. And there really is no excuse of I'm too tired, I've been on duty for too long, I'm the only one. If you know you can't take the heat, you stay out of the kitchen. So I think when we really look at the issues, we will always circle back to that one word, leadership.
Thank you, Dr. Roberts. So, as Dr. Roberts said, Honorable Commissioner, it's leadership. You're in leadership, and you're the Commissioner of Health in Ogun State. My question is, what is Ogun State doing to address these gaps? And is there any system that has been put in place to ensure that the average citizen or resident in Ogun State gets proper health care?
Sorry, just like Mrs. Coco, I made this a priority. You can see that I've got pharyngitis. But it's so important that I came, so I did come. But thank you for that question. I'm an obstetrician of 28 years experience. I left my job in England because I couldn't watch the maternal mortality in Nigeria any further. I wasn't asked to come to Nigeria. I just had this unrest. And so what I've been engaged in is there are 3 players. There's the leadership, they're the workers, and the citizens. And we all have our roles to play. The leadership, we need to look after our workers, because those workers are human beings. Some of them live in a non-conducive environment. They have to work in a non-conducive environment. They are not given the tools to work. They don't, where I come from in England, well, where I came from, you had continuous professional development. You were taught communication. Even as a clinical director, part of my continuous development was I had to do 5 key things. My communication, every year. Communication, safety, patient safety. That was done on a daily basis. So the structure isn't there yet, but it doesn't mean we can't achieve it. So that's the leadership just in a nutshell. Then the workers. I always said that medicine is a calling. It's not a job. Whether you get paid the right price or you don't. Not using myself as an example, but I've taken a pay cut because of the passion, a huge pay cut. So you have to be passionate before you go into the profession. We run a nursing school, 5 nursing schools in Ogun State. When I got there, the nursing schools, it's who knows who that gets in. I scrapped it. It's by merit. And I would personally go around on the day of the exam to reassure the students that it's not who you know, it's what you know. And when I got the pressures, there were people writing to my governor to say that you brought this foreign woman who's turned the system upside down. You need to turn the system upside down sometimes to make things better. And this is 3 years on. The same people that complained about me the first year, they're very grateful. The parents are reassured that if my child gets the right scores, they'll get in, regardless of who they are. So those are the little things that we can do. Then the patients. As patients, there are things that we can do. The countries that we're making examples of, there is the sustainable finance for the healthcare. You cannot give what you don't have. We have the NHS because over 90% are in sort of in employment in a structured environment, so they can tax them and then invest that into the healthcare. Unfortunately, in Nigeria, we don't have that. Only about maybe 30% of us are in the formal sector, 70% in the informal sector. So the government does not have a sustainable form of income to sustain the healthcare that we need. We need doctors, we need nurses. The ratio are abysmal. They need to be funded. So there's a law that came out. I'm trying to summarize because I could sit on this topic all evening and no one else will talk, and I don't want that. The one thing I'd like to plead with the public is last year there was a law passed, and the law said that we all must get a health insurance. There's over 200 million of us. If we all pay, whether you use the private or you don't, it's a social insurance. I might pay but never use it. But someone that desperately needs it, like the lady that you read that came with the postpartum hemorrhage. If the hospital, PHC or hospital, had the right equipment, the doctors, the specialists to attend to them, the light, someone was talking about generator. All these things, if we all get the insurance, just make it a point. Most of us, in my state, it's 1,000 naira a month. And that 1,000 would go a long way for a poor woman in a village when she needs it. We are signed up as a country to universal health coverage by 2030. We've only got about 0.5% of us on insurance. So we're way away from the universal health coverage. So what we can purpose as the patients is that we will go out and get our insurance so that there is, sustainable funding. There are many more things, but if I could stop here.
Thank you very much, Dr. Coker. I want to turn to you, Dr. Ajayi. Yeah, she's mentioned 3 different, the leadership. We've talked about the workers as well as the citizen. I want to say you play various roles in the sector, and from your experience, where would you say we need investment? Yes, we need different investments. So if an investor was here and is looking to where to invest in the sector, where would you say they should start? Or can you give a number so that those that are interested know where they can go?
Thank you. That's a very big question, and I don't know really where to start. But talking about transparency and the issue of governance, transparency, accountability are the basis for governance. And in healthcare, there's both corporate and clinical governance. But here we're talking and focusing mainly on clinical governance. And there are many issues within all the different stories that have been, related, that relate to different issues. Sorry. But what I would say is that if we could focus on some of them, if I could just outline a few, there's a huge issue with quality and standards. And that issue on quality and standards actually cuts across a lot of the other smaller ones. For example, your issues on transparency, your issues on, communication. Things like, for example, from my experience, when we set up the Pathcare laboratories, we wanted accurate and reliable results, because one of the things is that a lot of people get results and you have no idea whether they're accurate or not. And so going into getting the ISO 15189, which is an international standard, you actually have to achieve a number of things. You have to achieve your systems, processes and procedures, standard operating procedures that everybody has to follow. And if these are properly done, properly carried out, a lot of issues within them, for example, the issue of communication, how things have to be related to the patients, how you have to communicate issues, when things are done, what needs to be done next, who can call specific items, that if there's a crisis, who is called, when they are called, how all of those things can be documented. And so one of the things that we can do, particularly as a country, is to insist, for me, on international standards. And saying, because in most countries, these are a must. You have to, actually have these standards, and you must be assessed every year, and you must be signed up to it. Another aspect of it, because I think I'll just give three, I can't give just one alone, is external. The Care Commission, for example, in the UK, what Alero was talking about, having a place to go and complain, having a place to have those issues resolved is very important. We have our MDCN, but often the procedure and how to get, and even there's a process now in place, but how to access it, how to make sure these things are properly done, and there's a feedback loop. It's not a matter of just saying, oh, I'm complaining about this hospital, but there should be a way of going back to the hospital and engaging the hospital, ensuring there's training, there's development. It's not just a matter of, oh, you've been in a bad hospital, shut you down, because we can't even afford to shut down all the hospitals. You shut down the hospitals, where are you going to go? But there should be a mechanism, a feedback loop of development, and a way of checking out to make sure that those things are corrected. But I think if I was going to ask someone to invest today, the biggest thing I would want to ask for is data management systems. Centralized data management would go a long way and would help us leapfrog a lot of issues in the country. Because data management would enable us, number one, to collect data that we need. How are we really doing? Do we actually know? I'm not sure that we know. In fact, I will go so far as to say we don't know. We're just actually hazarding a guess. Do a sample here, do a sample there. You need accurate data. You need clinical trials to show what are those drugs doing. Often clinical trials are done abroad on foreigners. How does it interact with us and our DNA and our genetics? There's just so many aspects of it. I mean, again, like Dr. Coker said, you could spend all day talking about it. But data management systems, centralized data management, so that even when a person has their own information, they can have electronic health records, that when they go from person to person, they can have continuity of care, proper information given. When you go from one provider to another, often, your gynecologist doesn't know what your cardiologist doesn't know, what your diabetologist doesn't know what. So you're getting, bitty treatment, as opposed to getting one consolidated. And if they could have access to those records, I think it would go a long way, not just for the patient, but also for the provider. I think I'd stop here.
Thank you very much. So investment in data management and clinical trials are important ones.
The data management system, clinical trials, quality standards, all of those things are all part of it.
Thank you very much. Dr. Fejiro, yes. Nigeria Solidarity Support Fund. Yes, you were set up to help with the COVID and also to improve the standards. What would you say, since NSSF has started, has been your greatest achievement?
Thank you very much, Ms. Foma. For NSSF, we started in 2020 when we were in the heat of the pandemic, and became really clear that private citizens, we couldn't sit down and watch the government alone tackle COVID pandemic. So Global Citizens and the NSIA, which is Nigerian Sovereign Investment Authority, came together to form NSSF. And the purpose for NSSF was to support the Nigerian government to strengthen the health system. We're never really supposed to, on our own, strengthen the health system. I think that's a huge difference. A lot of NGOs are set up to create additional impact, but we know that the government is the highest funder for health. We know that the government is the highest authority and response person for health, and so we were created to support the government in whatever way we could to strengthen the health system. And since when we started, we have done several interventions, such as why we're here today. But the major one we've done was to support the government for the COVID-19 vaccination. As at 2021, the COVID vaccines came into place, and Nigeria was really lagging behind at that time. We had, by the time NSSF was approached by the National Primary Healthcare Development Agency, the NPHCDA, we were just about 4 million out of the numbers we are that are eligible for vaccinations, that were vaccinated. And so as NSSF, we thought that we are here to support the government, and one way to strengthen the health system was to end the pandemic. And one way we knew to end the pandemic was to get herd immunity for COVID. And so we supported the Nigerian government at that time to end the COVID vaccination. Now, coming out of that, we are looking to support the government to strengthen the leadership for health. And because we have picked that leadership is key for health system strengthening, we could support at the community level, we could support at the health facility level, but we feel that the leadership, everything rises and falls with leadership, and that's why we're here having this robust conversation today and making sure that we come up with advocacies and advocacy tools, and also ideas that we can work with the private sector to collaborate to strengthen the government and the health system of Nigeria.
Thank you, Dr. Fejiro. I'll come back to you, Dr. Alero. So yes, what I want to say, I'll give a success story, because we've spoken about some of our experiences. I was happy to read, I don't know how many of us know about a Poco doctor who found out last month he had a brain tumor. And against, like he said, his family and friends' advice to travel abroad for the surgery, he did it in Nigeria. And it was successful by a neurosurgeon when practicing at Luth, but he did it at Laguna Hospital. So we do have success stories, we do have cases, and I think, I don't know if we were put in that situation if we have done the same thing, but that's a success story. Is there any health system that has been implemented, whether at Luth or anywhere else that you're part of, that you can say, yes, it helped with transparency and accountability?
Yes, there are quite a few, and I think it's very pertinent to, I know the neurosurgeon very well, lovely, amiable gentleman. But I think it's very interesting that he didn't do it in the Lagos University Teaching Hospital and chose to do it in Lagoon Hospital. And it boils down to what you said, Dr. Ajayi, because he knew he had the capacity, he knew he had the competence, but he wanted to be in control of all the other factors, like the generator. Do you understand? The nursing care, because, you know, all too often we get a situation where the surgery was successful and the patient died, you know, because post-op is actually the first 24, 48 hours are the critical times for... The surgeon has turned his back, whipped off his gloves, gone home to a well-deserved rest, and he's suddenly, if he's in Lagos, battling traffic through Third Mainland Bridge to rush back to the hospital because 8 to 20 hours later, there's a bleed. That cannot be predicted. But we put, you know, he needed to be in control of everything that he could say, let me mitigate as much as possible, reduce the risk of something going wrong. So the fact that Lagoon Hospital is there, and I can mention it because it's in the public domain space, the fact that Lagoon Hospital is there, they've done what Dr. Ajayi mentioned in terms of clinical and corporate governance. They're meeting international standards, and we must really, you know, spend a bit of time, maybe not in this forum because we can each talk for the rest of the evening, but spend a bit of time in understanding what do we mean when we say international standards. Do we just want to copy the Western world, hook, line, and sinker, fisherman and boat? No. But there is an acceptable minimum standard to which, as human beings, we are called to attain to maintain life and limb. Because whether you are Nigerian, West African, Australian, or Ugandan, if you are left to bleed out, you will die. Bottom line. If your pregnancy-induced hypertension is not properly managed, you will have a fit and you will die. And these are the things that... So we've got a few systems, and there are... Yes, in Lagos, I know of quite a few, but I'm glad to say that I'm hearing of a few more in other parts of the country who have pledged and committed to an international standard because they want, you know, they want to, as Dr. Coker said, you know, they don't want to sit back and not be part of the solution. We can't continue to hear these stories and not be part of the solution. So there are a few. I want a situation where people feel comfortable, because for us to be able to create the demand for these international standards. And in order to create the demand, we also, at the same time, have to take some collective responsibility to making sure that they come to pass. We need to pay our taxes. Barest minimum. We need to pay our taxes. We need to buy into this. I was trying to do a bit of arithmetic, but numbers are not my strong. But if 200 million Nigerians paid 1,000 naira a year, not a month, a year, I think that gives us 200 billion every year that can be deployed to the health sector. And for preventive care, I'm a public health physician, so that's my forte. For preventive care, that will do a lot. Certainly, even if the woman chooses to deliver at home, and it is well within her right to do so, in some cultures in Nigeria, that is the accepted practice. We can then get trained midwives to her in the home with mama kits to assist in the delivery so that we meet the cultural acceptability and minimize the clinical dangers. So there are. Thank you.
Thank you very much. Unfortunately, we've run out of time. I want to say a very big thank you to all the panelists here for taking time out. Dr. Tomi Coker, thank you for coming even though you're not feeling too fine. Thank you, Dr. Fejiro. Thank you, Dr. Alero. Thank you, Dr. Pamela. Oh, okay, yes. Sorry, with just 2 more minutes. Honorable Commissioner.
Sorry, I think I can't go away with the transparency and accountability. I think it is in the public's right to hold us accountable. You have to. You have to look at the budget. The budget is published on the website every year. We have annual operational plans. Get hold of them that we in health say we're going to do. There's a commissioners forum where you can report whatever you don't like. My number is available in all the health facilities in my state. I get phone calls at 2 a.m. and 6 a.m. to say, I've been waiting 30 minutes, 1 hour, and they haven't answered me in the teaching hospital. It is in the public domain. It is your right as a citizen. But you too, you have to do your own civil responsibility and pay the tax. Please, that is my bane. Thank you.
Thank you very much. Thank you so much.
Can we give a round of applause to the phenomenal panel discussants and, of course, our excellent moderator for such an insightful session. Thank you for speaking from a personal place and also from a professional space as well. Thank you. Really grateful. Thank you so much. One more time, another round of applause as they take their seats. Thank you. Dr. Fejiro, thank you very much. Dr. Alero Roberts, Dr. Pamela Ajayi, Dr. Tomi, and of course our moderator, Mrs. Ifeoma Monye. A round of applause, please.